Well, this project originally started as a result of work that I'm doing, sitting on the board of a organization, Matrix Human Services, here in the city of Detroit, whose mission statement is to break the generational cycle of poverty in the city of Detroit. And what I learned was that there were certain methodologies being applied to support families or individuals who were trying to bring themselves out of poverty or the situation they found themselves in. I just felt like, the one institution that would be best to really be the conduit to help people in the community is the church, because they come to the church all the time for help, right? So my thought was to take what I would learn, if you will, from the work of Matrix and bring it over into the faith-based community and allow the faith-based to be trained, if you will, in the methodologies that were being applied so that we could be a bigger army. I just thought this would be a wonderful opportunity to serve in a bigger way and to be able to reach more people through a network of churches. And that's kind of how we got started. We had a young lady come to our church, and she knocked on our door, and the church, of course, is closed at this time. That happened to be a Friday evening, about 7:00 p.m. They came to the door and answered the door, and the young lady shared with them that she needed help and support. And she found they found themselves not having stable housing, and they were pretty much in the street. And she had 2 babies and was pregnant. We took a hold of the family, and we began to support them with connecting them with resources and things that they need to get themselves back on the right path and to build up the hope that we hope that everyone would have for a better life.
We came across the church because we were illegally evicted from our apartment. We stopped, we talked to someone, and she directed us to David. And he's been helping us ever since. They helped us with food, clothing, furniture. It's been great since he's helped us. It's been great. It's like we get a little rough patches here and there, but he really changed our life because we really thought we was never going to get back on our feet, especially with 3 kids.
Our powerful technology platform, the Community Care Hub, where we have technology tools to be able to do what we call health and wellness assessments. And when the individual gives us permission, we do 2 things. We do a Social Determinants of Health assessment, and then we also do a behavioral health assessment to check their mental well-being. And so once you have a profile on an individual, you can work with that individual to create their plan for what it is that they need and want. And then you can develop a strategy to meet the need. The United Way's been a fantastic partner. It's really the backbone of a lot of the work that we do. The referrals and the resources that we refer people to come from the United Way 211 database. I can tell you RIVERSTA'R's been great all along, all the time that we've been associated with the platform and their leadership. They've been a wonderful group to work with. They've been patient with us. They've been accommodating, and we've gotten all the help that we need to make sure that we can do the work that we had before us using the tool. They just came out with their new version, and man, oh man, are we excited now. We're like a kid in a candy store, because all the things that we thought we were challenged with before now are all right there at our fingertips, the referrals and how all the referrals come up on the different needs, and they pop up when we do our Social Determinants of Health assessment, and it identifies the low scorers, if you will, on the assessment. It populates automatically these as needs, and it puts them all in a little file, if you will, over to the side that says, here's all the needs that have been identified. And you're like, wow, it's like we're answering the questions and everything's popping up for us. We don't have to go do any searching and getting on the telephone and making the phone calls like we used to do when we first started, before we had the platform where everything was manual and hands-on. It's like this warp speed. There's checks and balances within the care hub on how soon a person needs to check on the referral and make a note that send me back a message that they've done the referral on, because there's timers and ticklers that will say, hey, this one hasn't been done in 2 days. And there's flags drawn now. It's like, okay, we need to follow up and find out what's going on. Our goal, though, is to spread this really across the whole city of Detroit. We think we have a template that we can just take across, not only locally here in Detroit, but we can take this across the country. That's the vision of Detroit Community Care Network, is that we empower the churches with the methodologies and the processes and the resources and the partnerships and the stakeholder partnerships that we have. And as a community, we wrap our arms around one another.